Hello everyone, my name is Ashley and today I'm speaking about ethics for paramedics. First of all, what is ethics? Ethics can be defined as a set of moral principles and values. Through ethics, actions, social practices, institutions and systems can be determined as good or bad, right or wrong, and why. In other words, ethics helps to determine whether things are moral or immoral. According to Gensler, ethics can be culturally influenced, where things that are considered to be good mean that it is socially acceptable and approved. This concept is called cultural relativism. However, Gensler did point out the flaw in this concept, where if a socially approved thing is good, then it could be said that something like racism is good, because good just means socially approved. There are four main principles in ethics: autonomy, which is respecting the person's right to make their own choices; beneficence, contributing to one's welfare and providing benefits, in other words, acting for the benefit of others; non-maleficence, the obligation to not inflict harm intentionally; and finally, justice, treating everyone fairly, equitably, and distributing benefits and burdens fairly. There are several ethical issues that are commonly faced by paramedics. For example, autonomy can present a dilemma when a patient chooses to not receive appropriate treatment, thus potentially putting them at risk to experience severe negative consequences. In this case, is it ethical for paramedics to let a patient go, or is it morally justified to insist they receive appropriate treatment? Overruling a patient's decision is called ethical paternalism, where a patient is influenced to decide against their own wishes. This dilemma is particularly tricky for paramedics because if they let the patient go, there is a risk that the patient could develop severe health issues that could have been prevented. However, if the patient is well informed of the situation, paramedics do not have the power to overrule the autonomy of a patient. Justice can also present ethical issues for paramedics. It is not always easy to treat each patient with fairness in all situations. Conflict in justice arises particularly when there are not enough ambulances to respond to an emergency. In this instance, cases need to be prioritised based on urgency, meaning that emergency calls that are not considered to be particularly urgent, these patients may have to wait quite a while for medical assistance. Therefore, when patients are treated according to preference, ethical concerns are raised. Furthermore, paramedics can encounter beneficence and non-maleficence ethical issues during the treatment process. As mentioned previously, beneficence is the principle in which health professionals must act for the benefit of their patient. However, it is not always as simple as just giving the patient the best possible treatment for their injury. Paramedics have the responsibility to consider the patient's psychological and emotional state and make sure to not cause mental harm for the patient during the treatment process. In Australia, paramedics are required to follow a code of conduct which provides guidance about ethical practice. This code of conduct outlines what is required of paramedics in order to provide the best possible level of care. These requirements include integrity. Paramedics must be honest, sincere, and trustworthy when performing their duties. They must not act in any way that may discredit their profession. Respect. Paramedics must ensure that they demonstrate respect for the clients through their actions and treatments. They must provide care at the highest professional standard. Responsibility and accountability. Paramedics must take responsibility and be held accountable for their professional decisions. Competence. Paramedics are required to maintain and improve their knowledge and skills. Furthermore, they should mentor student paramedics. Consent for patient care. Paramedics are required to receive informed consent from their patients before providing treatment whenever possible. Confidentiality. Paramedics are required to keep all information regarding their work confidential. They are not to disclose this information to a third party unless they are legally required to or have a professional duty to do so. Research. Paramedics should contribute to, promote, and support research in pre-hospital care practices and ambulance service management where possible. Ethical review. Paramedics must participate in ethical reviews of their actions regarding their professional conduct. A case study was found on the East of England Ambulance Service website titled May 2018. This case study involves a paramedic, a patient, and the patient's partner. The case study speaks about a lady who fell within her home. An ambulance was called, and when the paramedics arrived, the patient was lifted from the floor to a bed and assessed. The paramedic considered sending the patient to the hospital for assessment, but was influenced by the patient and her partner to allow the patient to stay home. The patient's partner was determined to keep her at home as he was planning on taking her to an already scheduled GP appointment later in the day. Following these wishes, the paramedic simply advised that if paracetamol and ibuprofen did not settle the pain, to call for another ambulance. Following this assessment, the patient was still experiencing severe leg pain and called for another ambulance. She was taken to the hospital for assessment and later complained about her initial ambulance experience. This case raises ethical concerns in which a paramedic was able to be influenced to go against their better judgment. There are a few ethical principles that are relevant to this case study. For example, autonomy. While the paramedic respected the principle of autonomy when allowing the patient to make the decision to stay home, they failed to ensure that the patient was capable of making informed decisions regarding their health. While the paramedic did stress the importance of receiving an assessment at the hospital, the patient suffered from dementia. As a result, dementia patients often do not provide an accurate pain analysis. However, as the paramedic did decide to respect the patient's autonomy, they should have safety netted the patient to an out-of-hours GP, their own GP, or a healthcare practitioner when leaving the patient at home, rather than just advising them to take pain medication and to call another ambulance should that not help. Another ethical principle that's relevant is beneficence. The paramedic also did not comply with the principle of beneficence. While the patient did not agree with what the paramedic thought to be the best possible treatment to benefit the patient, the paramedic failed to safety net the patient to their GP or ensure that they received appropriate treatment while at home. The paramedic was aware that further treatment was required apart from taking pain medication, and should have ensured the patient received more appropriate and beneficial care. The paramedic was given advice regarding dealing with difficult assessments of patients with previous conditions. In addition, he was given advice on assessing patients with dementia. Finally, a discussion was had with the paramedic on how to lead patients on to care through GP or healthcare practitioner services when they decide to be left at home. It is recommended that paramedics should undergo recurrent training and personal development to ensure that they are up to date with the ethical requirements of paramedics. This should require going through the code of conduct in every session to reaffirm what is expected of them. For this particular paramedic, it is recommended that he attends training for the ethical principles, particularly autonomy and beneficence. As this case occurred in England, they and all paramedics in England should receive professional training and personal development sessions on how to deal with patients suffering from dementia. The Yorkshire Ambulance Service provides a dementia learning resource for ambulance staff. This resource contains facts about dementia and how to effectively communicate with and treat a dementia patient. Additionally, this resource provides further information such as the Yorkshire Ambulance Service Dignity Code, which informs paramedics about how to treat dementia patients with dignity and respect. Thank you for watching, and I hope this was beneficial for paramedics learning about ethics in their profession.